Hello, my name is Hui Zhang. I'd like to give you a brief overview of my article. Development and validation of a model for predicting the risk of death in patients with Acinetobacter baumannii infection, a retrospective study. Acinetobacter baumannii is a gram-negative opportunistic bacillus which can cause a widespread nosocomial infection. Our aim is to establish a model for predicting the risk of death caused by Acinetobacter baumannii infection. The development group comprised 315 patients with Acinetobacter baumannii infection admitted between January 2013 and December 2015 in our facility. 272 patients in the validation group were admitted between January 2016 and December 2018. The variables entering the model were screened by univariate and multivariate logistic regression, and the appropriate nomogram was established. Then the relevant evaluation indicators were used to evaluate the discrimination, clinical decision-making ability, and calibration of the two dataset models. The results showed that the infectious source, carbapenem-resistant Acinetobacter baumannii, hypoalbuminemia, Chilson Comorbidity Index, and mechanical ventilation were independent risk factors related to death. The area under the curve of the receiver operating characteristic curve of the two groups were 0.768 and 0.792 respectively. The net income was higher when the probability was between 13% and 18%, showing a strong discrimination capacity of the proposed model. The calibration curve swung about the 14.5-degree oblique line, indicating a high degree of calibration. To conclude, we developed and validated an individualized prediction model for predicting the risk of death from Acinetobacter baumannii infection, which could help improve the early identification of patients with a higher risk of death and guide appropriate clinical treatment. Thank you very much.